Hello, my name is Marcy Wills. I'm one of the occupational therapists at Worthing Hospital. Occupational therapy is something that looks at the activities of daily living, and we often look at fatigue management, which is something I'm here to talk about today. So I'd like to talk to you about what cancer-related fatigue is, what some of the signs and symptoms are, some of the causes and the management strategies and how we can help. So what is cancer-related fatigue? The clinical definition is cancer-related fatigue is a distressing, persistent, subjective sense of physical, emotional, and/or cognitive tiredness and exhaustion related to cancer, cancer treatment that is not proportional to recent activity and interferes with the usual functioning. However, I think the simplest explanation for this is that empty feeling, the running on empty and just not having the reserve. Okay, so what are some of the signs and symptoms that we might be looking for? It's important to remember that these things are very individual. You may have some of them or not all of them. It could be anything from difficulty in concentration, memory problems, difficulty with making decisions. It could be shortness of breath after minimal activity. It could be feeling very emotional, tearful, or upset at odd times. It could be a general lack of energy. Some people experience dizziness or weakness, and some people have difficulty sleeping. Some of the other symptoms and issues that we're looking for are looking at the pain cycle, the experience of pain. Fatigue often impacts the pain cycle, increasing your experience of pain. It could be breathlessness caused as an effect or leading up to into the fatigue cycle. Some people have issues with fluid management, often retaining fluid, which also makes people more tired. Any other medical conditions can also compound the level of fatigue. If you have any other medical history, like issues with your heart, issues with your lungs, your thyroid function, or perhaps diabetes. Some side effects of medication can also increase fatigue levels, unfortunately. So some of the causes that we might be looking at, it could be the cancer itself, it could be changes in appetite that might affect fatigue level, or it could be a result of other symptoms like the fluid retention, pain, or other breathlessness that you might already have. Some people have anemia, which often impacts the level of fatigue. And some of the cancer treatments themselves, whether it's chemotherapy, radiotherapy, or hormonal therapy, may also increase your fatigue level. So the first area that we want to look at is diet and appetite management, which is often a problem for some people during their cancer journey. It could be related to the change in taste or just the change in appetite, especially after chemotherapy, that impacts your level of intake, that impacts the fatigue cycle. Some people experience nausea, and it's a balance of finding the anti-sickness medication that might help you to improve your intake. The ability of the body to absorb nutrients can be affected, or it might be something that you already have a problem with. So it's important to look at the quantity and the quality of the food that you're able to manage during your cancer journey and your treatment. It might be that you need help and support preparing food, or looking at how you can make the best of your meals. So it's never a bad thing, whether it's a ready meal or something easy for you, or a matter of somebody else helping to provide the food to optimize your nutritional intake. And it could be the timing of the meals. It could be something to look at timing, whether changing the times of your meals, eating smaller amounts, might help you to get the intake that you need to have the energy that you need. Dietitians might talk to you about meal replacements to help your intake during the day to make sure that you have enough energy for your daily activities. Looking at treatments and chemotherapy and radiotherapy. So during chemotherapy, most people often feel fatigue in the first few days after beginning treatment, and it may increase with each successive cycle of treatment. This, unfortunately, can be normal for some people. Radiotherapy might be a slight delayed effect, but often it increases also with the number of treatments that you may have. Also, with the biological and hormonal therapies, most people do look at experiencing some level of fatigue. And it's important to remember during your treatment that the energy needed for the healing process is also increased. Your immune system is recovering, and it typically follows completion of treatment that people experience a slow easing of the fatigue management and fatigue cycle. Most people find that within 6 to 12 months of cancer-related fatigue that this starts to improve. Some people find that it can last for longer than this period of time. It's a very individual journey, and I can't put a number on the fatigue that you may or may not experience during your journey. A big problem for some people impacting the fatigue cycle is anemia. That means a low amount of hemoglobin, or that some of your blood cell counts may be off. This can be from a pre-existing condition, or it also can be linked with your chemotherapy or any other therapies. Anemia affects fatigue by leading to breathlessness. Some people experience lightheadedness or dizziness with activity. Some people also experience angina or chest pain. It's important to talk to your medical professional if you're feeling any of those symptoms. Pain is another thing that can affect your fatigue cycle, whether it being physically or psychologically. Being physically uncomfortable can reduce your emotional resilience, which kind of impacts the fatigue cycle. It's finding a way of breaking that cycle and managing the pain. Unfortunately, some pain medications do have this side effect. It's a matter of working closely with your medical professional about finding the balance to manage your pain, but not yet be too tired. So what things can we do to help manage? So we look at a number of topics. I'd like to look at physical activity and exercise, sleep, relaxation techniques, adaptation of activities, planning, fatigue diary journaling, stress management, and considering fatigue versus depression. So the first area that you might look at is physical activity and exercise. So despite what you might think, exercise has been shown with research to actually positively improve the fatigue cycle. Exercise reported in the research often included either some sort of aerobic exercise, bicycling, or walking-based programs. Appropriate exercise programs can be discussed with your healthcare professional, like your doctor or a physiotherapist. Hopefully many of you during this process will be in touch with a physiotherapist. So looking at the cycle of fatigue, we look at the decreased activity level leading to decreased strength and activity tolerance. And looking at this also turns to increased fatigue over time. It's hard to break that cycle, but it's important to find a level of activity for yourself that balances out and helps you to break the cycle. This could be very individual. It could be something as simple as light household activities, or it could be structured exercise. It's really important just to find the balance for yourself. The next area that we often look at is sleep. Sleep is a very important thing, and unfortunately, people who experience cancer-related fatigue don't always feel that the amount of sleep that they get is proportional to the level of fatigue that they are experiencing. So optimizing the sleep is the best solution that we can perhaps look at together. It's really important perhaps to have a bedtime routine. This could be something as informal as just making sure that you're getting ready for bed mentally, putting your pajamas on, doing things at a usual time. It's often important to avoid screen time. Blue light has been shown to impact our brain cycles and in the preparedness for sleep. So it's important to put the phone down and just be mentally ready for sleep. Reducing the lighting often helps, whether it's turning off overhead lights and increasing just small bedside lamps and that sort of thing to get your brain quieted down for the night. Light physical activity for some people can be the stimulus and trigger for being ready to go to bed. So as much as being quiet before getting ready for sleep, some people find that a little bit of light activity, whether it be household activity or a slight stretching and exercise program before bedtime, might actually be of benefit. Some people find that they're hard to shut off their brains when they're not ready for sleep. It might be something to have a worry journal, to write down those thoughts that you don't want to think about at night, so you can close the book, put it down, put it on the bed table, and put those thoughts out of your mind. Some people find the ritual of having a warm drink at bedtime of great benefit. It's important to avoid caffeine, cigarettes, and alcohol at bedtime as well. And the use of white noise or light, quiet music might be something that helps, especially if you have other things like tinnitus in the background. Many people find these things relaxing. Speaking of relaxing, we have relaxation and complementary therapies. This might be a time in your life where you decide to explore something new. It could be something as simple as meditation, whether it's a guided application, a CD, or some sort of digital file that you listen to help you guide your relaxation. Some people choose to explore acupuncture, aromatherapy, reflexology, or music therapy during this time in their life. Many people find massage relaxing, but it's very important to think about what you find relaxing, not just what others find relaxing. And remember, there's always an app for that. Occupational therapy often looks at adaptation of activity. So we look at the level of effort required and what supports might benefit to make the job easier. So most times I suggest that many activities that we do during the day can be done sitting down rather than standing, whether it be showering sitting down, ironing, or doing preparation for food sitting down. It might take less time and effort to be able to do these activities sitting. Simplifying the activities, making them easier, or doing them in stages. Many people use ready meals or cook ahead. Avoiding reaching and bending can reduce the activity level needed for completing an activity. Avoiding heavy lifting when possible also makes things easier. And accepting help when needed. It's sometimes easier to have a little bit of help and then resume the activities when you're physically able to continue. And remembering to wear comfortable clothing, something that's not impeding your activity in any way. Planning is a really important part of activity management. Planning the activities during your day, alternating light and heavy tasks, can sometimes really make a big difference in impacting the level of fatigue that you experience, whether it's dividing the tasks into smaller portions or whether it's letting somebody else do part of the work for you again, and also planning time to rest. And the other question that I often ask people is, does it really need to be done now? Prioritizing these activities that you have to do during the day and saying, I can do these things today and these things can wait until tomorrow, sometimes really helps people to manage their fatigue. A lot of people look at diaries and journaling to help with the planning process. It helps us to look at the times when you're feeling your best during the day and to understand which days may be better than others to do the heavier activities during your routine. And it might just help schedule the activities on days where you're feeling a little bit more and days where you need more time to rest. Stress management is something that I'd like to go into a little bit, but I think it's something that we'll discuss in another video as well. Looking at your stress levels can also impact the cycle of fatigue. Stress often is not, in this situation, a good thing, and we need to look at other ways to management. It can be anything from talking therapy, complementary therapies, the relaxation techniques that I've mentioned earlier, and talking with your medical professionals. Fatigue and depression is the last area that we'd like to consider. This is sometimes hard to distinguish between fatigue and depression, considering that some people experience both at the same time. It may be hard because the symptoms overlap to understand which thing is affecting you more, or if you're having both at the same time. Anxiety, depression, and fatigue can all lead to altered ability to participate in your daily activities, your functioning, your sleep, and change in appetite. So addressing these issues with your medical professional can help to relieve your fatigue and your overall quality of life. I think it's really important that we understand that everything happening all at the same time leads to stress, and we need to look at the whole picture and able to help you the best that we can. So make sure that you have any concerns addressed during your visits. If you need to, write these things down so you can remember to address them with your healthcare professional. Be sure to look for any other resources online. The Macmillan team are here to help. Many thanks.